like to ask the Minister for Health and Social Care whether his department would support the Daily Mile activity being introduced at all primary schools and the Fit for Life programme in secondary schools.
Will the Minister for Health and Social Care to reply?
Thank you, Mr Deputy President. Obviously, the first thing to say is that the introduction of any of these programmes into schools would actually be within the remit of the Department of Education. Having said that, the Department is supportive of the Daily Mile and the Fit for Life programme as part of the overall approach to physical activity in schools. The benefits of physical activity across all aspects of physical and mental health and well-being are well established. We also know that activity can be easily included in the daily routine and is the best way of ensuring that it becomes a habit that people will continue throughout life. Having said that, though, it is important to recognise that each child is unique, and the Daily Mile and Fit for Life programme may not be suited to all children. That is why it's important that there's a wider programme of physical activity and opportunities open to children, rather than simply focusing on one particular programme. Children and young people spend a large part of their time in schools, so schools are ideally placed to support the exercise habit. This can be done through offering a range of sports and activities to cater for all tastes, abilities and levels of fitness. As the Minister of Education said in another place on the 22nd of May, it is important that we encourage and develop a strategy that encompasses and encourages all children, regardless of their current level of physical activity, and that the Department of Health and Social Care will continue to work closely with the Department of Education in that regard.
Supplementary question, Mrs Caine.
Thank you, Mr Deputy President, and I'd like to thank the Minister for that full reply and the support for expanding the amount of daily routine physical activity that we would like to see across the island. Can he confirm that his department is working closely with the Education Department to enable more access to routine physical activity and to tackle the childhood obesity levels, which his department has now said are 25% of young children now classified as overweight and obese on the island, and whether he will look at implementing programmes with the Department for Education to monitor how those levels are impacted by the increase of physical activity.
Minister to reply.
Thank you, Mr Deputy Speaker. In relation to the obesity, first of all, one thing I should clarify, of course, is that the written answer published, I think it was last month at this sitting, Mr Deputy President, was a snapshot of children coming into the reception class. So they were coming into the school. It isn't a snapshot of the entire school population, and I think that's very important to emphasise. In relation to working closely with the Department of Education, we always do, we always have, the department as far as I'm aware, and we hope to continue that cooperation. In fact, I have a department member that crosses both departments, and Mrs Corlett. Also, equally, Mr President, I think one thing that should be put on record is, and I'm not trying to tread on the Education Minister's toes here, but I think that the facilities we have in terms of greenfield space and also areas for sport and activity, to be frank, a lot of schools in the UK would give anything to have. I think we are very lucky on the island in terms of that, and I think sometimes we don't recognise that quite enough.
Supplementary question, Mrs Caine.
Thank you, Mr Deputy President. It's the last one from me. I agree with what the Minister is saying, but would he agree that more data needs to be gathered, tracking children throughout their careers in terms of the routine physical activity they undertake and the impact that has on obesity levels? Can I ask the Minister, what are his priorities for the coming months and year to ensure that we don't fail future generations of children in the most basic education of how to stay fit and healthy?
Minister to reply.
Thank you, Mr Deputy Speaker. As I've said previously, it is something that Public Health is looking at, particularly in relation to childhood obesity, and bringing forward a strategy that we can develop in working with the Department of Education and all the departments to tackle that. In relation to data, well, I'm a project manager by trade, Mr Deputy President. As much data as possible. I love data. I think as a department, DHSC hasn't necessarily always been great at getting the data sets in place, but it is something that we're striving to do. And again, I know it's something that Public Health is exceptionally keen on, as I'm sure she's aware from talking to the Director of Public Health, that we need more data, more accurate data and more useful data so that we can tackle head-on these issues.